Hey guys, it's Emma. I'm here for my 1 year post-op RNY gastric bypass follow-up. I just left my surgeon's office and I think I got a little bit of good news and not so good news. The good news is that I am within my ideal weight range and all of my labs came back. He said exceptionally well. There's no concerns regarding all of my vitamins levels. Everything came out really good. He says I'm very healthy. And he even gave me a big hug and was like showing me off to his medical assistant and his nurse, saying that I was one of his star patients. So he just made me feel really good. I've been very blessed that my surgeon, I've had contact with him throughout the year. He's been the only person that I've seen since starting this whole process, so he's been able to really get to know me and talk to me about what works, what doesn't, some of my struggles. We talked a little bit about my fear of being able to eat more lately and regain. Sorry, the view is really bad. It's kind of dark, but so, he said it's kind of normal that I'm going to be eating a little bit more now. He did suggest that if I do feel hungry, maybe increasing some of the protein that I eat. So he suggested having some hummus with carrots, or he doesn't really like me to have, I really don't eat bars or even drink a lot of protein shakes anymore. I'll have a protein shake if I'm really like in a bind or haven't been able to consume as much protein from my food. So he just told me to keep eating how I'm eating, that everything's well. The not so good news is that I know I've talked to you guys about having some side pain. Well, it kind of went away and then it started back recently, and I was thinking that it was probably from the running. Like I was thinking maybe I don't know, like maybe I pushed myself a little bit too much, but I had 2 different occasions this past week where I had really severe side pain where I couldn't even like, I pretty much stayed in that position until the pain went away. So we talked about it. I showed him exactly, he made me lay on the bed, showed him exactly where it was that I was having the pain. So he's concerned about gallstones. I have an ultrasound scheduled for Thursday morning at 9 o'clock. So kind of sucks. I have to fast from 12 o'clock the day before till about 10:15, 10:30 that I have the ultrasound. So that's a long time. I can't even have water. So hopefully I should be okay. But he said once he gets the results, he will be contacting me to see whether or not we need to schedule surgery. So he said it's really not an option. If I do have gallstones, he's scheduling surgery for me. So I'm praying to God. I'm just praying that I don't have to have another surgery. But if I have, I don't want another surgery. I really don't. And I just don't. I don't have the support, like family here to help me. That process was really hard last time by myself. I have friends, but I just don't want to go through that. I'm not in a position, I'm going to stay positive and just think about, hopefully everything's okay and maybe I just need more water. Fingers crossed, praying, and so that's all I have to update. But everything, my labs were good, and that's what I'm really excited about. So moving forward for another year. So if my ultrasound is if I don't have any gallstones, then I'm scheduled to see my surgeon in 6 months again. So I will keep you guys updated. Bye.